this audio lecture, we're going to be talking about respiratory acidosis. So from the name, we can tell that this is a pulmonary of origin disorder, and so we're going to get changes in carbon dioxide release. And then from the second part of it here, acidosis, okay, we can tell that we are dealing with a decrease in pH resulting from the increase in partial pressure of carbon dioxide. So next up we have respiratory acidosis. Okay, so this is due to a change in the respiratory system, right? And so this is going to be a decrease in pH due to an increased in partial pressure of carbon dioxide. Okay, so we might be observing here to cause this impaired alveolar ventilation, meaning we're not exchanging as much gas as we should be. Okay, this can be due to several disorders. First of all, lung disease, emphysema specifically causes it. Maybe your central nervous system isn't sending the right signals along the ventilatory tract. So make sure you guys review that and you know how it's involved in maintaining the rhythm of our respiratory muscles. Okay. And then finally, ventilatory muscles. So maybe we're seeing some atrophy or some reduced drives to use them. Okay. This can be acute or it can be a chronic condition, such as the case in lung disease. That would be a chronic condition, right? Whereas acute would be maybe something that affects the ventilatory drive. Okay. So acute disorders, we'll have here is a rapid increase in arterial PCO2, so meaning we're not ventilating our lungs enough. Okay, this is negligent of the increase in bicarbonates. Okay, this can be the result of several disorders, including malfunction of the respiratory centers, so the ones that generate the drive. Okay, could be caused by lung disease, chest injury, or weakness of respiratory muscles. So pretty much all those other other causes on the other page. Okay. We see that chronic acidosis is due to sustained increases in partial pressure of carbon dioxide, whereas before it was just a real quick response. Okay. We have a renal compensation. We have an increased serum bicarbonate, so the kidneys are increasing their reabsorption and probably production. Okay. And so we see a reduced pH decrease, actually. So this kind of buffers a little bit. Okay, in chronic obstructive pulmonary disorder, okay, we see the renal secretion of hydrogen and bicarbonate secretion to compensate for the increased PCO2. Okay. So you can produce increased levels of CO2. I think we're all aware that exercise can cause it by increasing the activity of your muscles. Fever, you're going to have extracellular processes that are undergoing, and then your metabolic rate just increases as a product of the temperature going up. So that's just when you're trying to produce all these immune proteins to kind of fight off this condition. Okay, and then burns. We could get pretty much evaporate, loss of the environment through secretions on the skin. So a 1 degree change in the temperature in Celsius equals a 13% increase in the metabolic rate. So we see a big change. Okay? A diet high in carbohydrates will produce more carbohydrate per unit. Okay? Healthy individuals generally offset on any increased production of acidosis. Okay. And then diseased individuals with lung disease probably are susceptible to this as well. All right, so respiratory acidosis is going to manifest itself as a pH in less than 7.35, so outside of the low range. Okay. PCO2 being greater than 50. Okay. Some specific organs that will be affected, we'll see the nervous system, headache will be present, behavioral changes could follow. You can go ahead and look at the table 8-11 for all those disorders. Okay, just overall weakness. Okay. So the skin is going to be warm and flushed, you're going to have vasodilation occurring, and we'll have tachycardia, right? And why would we have tachycardia? because currently the body temperature is elevated, okay, or should be. You have increased metabolic activity, okay. We need to get more oxygen to those cells to do their work until things can slow down. So you see tachycardia is because we have an increased cardiac output because metabolic rate has increased, right? And then we have a low pH. Much like all the other conditions that we've talked about so far, we're collecting a patient history and a physical examination. Um, and so we're going to be, this is where the arterial blood gases really become important, right? So the arterial blood gases are going to tell us that now we have an increase in carbon dioxide, partial pressure of carbon dioxide above 45 millimeters of mercury. Blood chemistry is going to tell us that we have really this elevation decrease in pH. Okay, complete blood count is not really going to tell us too much about the condition, other than maybe something about erythrocytes. Okay, chest X-ray is going to tell us about really the cause of the pulmonary condition, of the respiratory condition, why we are seeing that acidosis. Okay, so to treat respiratory acidosis, generally you try to improve ventilation, right? So by putting a breathing mask or breathing tube into them, sedating them, okay, that can improve ventilation. So adjust the partial pressure of gases.